Hi, this is Brian Murmurs recording a lecture for pediatric nursing, and today we're going to be talking about communication history, physical and developmental assessment. So a lot of this stems from what you've already done before in physical dimensions and for med surg, and now we're just going to kind of tailor this a little bit towards pediatrics. So as we're going through this, you can look through these objectives, but we want to have good communication with parents, and that's important because, those are the people that have got the ability to give consent and are sometimes the most concerned about the care of these children. And so we want to be on board with them, and we want to have great communication with that caregiver. We want to establish trust, we want to build that relationship, and to be reliable, and like I said, build that relationship, and also so that way the kid will trust you as well. If they really see that the parents and the caregivers trust you, then they'll start trusting you as well. So a lot of things when we're talking about interviewing parents, we could talk about CIMPs, so chief complaint, immunizations, allergies, medications, past medical history, events leading up to this, diet and diapers, and then S, the situation that brought him in. So anticipatory guidance, we want to talk about that. We've talked about this before in this class, but it's what's the kid going to go through next, and what can the parents expect? We want to know about that to try and prevent any bad things from happening and just help the process of them raising this child. So communication with children, remember that you are big and scary. So if you look at this picture, she's not facing, staring the kid down. She's not directly in their face. She's off to the side. She's down on their level. And you're going to see that. Look for those nurses on the pediatric floor and see how they communicate with kids of different ages. And you're going to see them do a lot of nonverbal stuff. When they want to grab attention, they're going to use their hands more. They're going to be using way more nonverbals. You can't run into a room and expect the child to honestly trust you or like you. You can't just expect they're going to run up and give you a hug. You can't just go in there and start doing your vital signs because that's kind of threatening. They need a little bit of time to warm up to you. So don't forget about that. So, and you can kind of see these things here. So, be non-threatening as much as possible and watch your nonverbals. Early childhood, we really have to watch and see what they do with this in regards to letting them touch as much equipment as possible. They're curious, they're exploring their world, they're very sensory yet. So they want to, see the blood pressure cuff, they want to see the stethoscope. Let them touch as much as they can. I mean, it's not like I don't want them contaminating sterile fields or doing IVs or any of that stuff. But I've taken the needle part out of an IV and let them touch just the catheter. And that's been very important for them to see that that's like a little straw. And so you're going to see all this kind of stuff. You need to be very direct and very literal with kids. The example here is, we're going to put a little stick in give me a little stick in your arm when you're talking about like an IV. They might take this literal. Otherwise, if you say, there's a purple dinosaur in your ear, they might take that literal too and wonder, how am I going to get that thing out? So at this age, they tend to be very literal, and the more choices and the more tactile things that you can do with them, the better off you are. They also have this wonderful thing called animism, so they might relate something to something that they know about. So if they've got a tubing or something like that, they might think that that looks like a snake, or something looks like monsters, or those kind of things. So really try to, let them see what you're doing, let them have hands-on approaches, and so they can discover these new things and not assimilate them with other things that they might know. School, they want to know why. So once again, help them, walk them through, anticipate, what questions that they'll have. Okay, well, first you're going to see this, and then we're going to go here, and then this is going to happen, and guide them through the process, and that will help out. That'll also help them with their curiosity. For both school age and the preschool kids, having dolls, having child life there will help them out tremendously. School-age children are also really concerned about their genitals and about blood leaking out. So things that, Foley catheters going up their genitals or IVs or blood draws can be very, very scary for them. Adolescence, this is a difficult age because they kind of fluctuate. They go between adult and they go between school age, and that's been shown on many MRI scans, and that's just part of development. But we have to realize that they go back and forth between concrete and formal operations, and so we have to be ready to treat them like that. Do not treat them like little kids. They will not appreciate that, and you'll lose any rapport you have with them. Try to treat them adult-like as possible, and that will go a long ways. So as we're kind of talking about this, I know it sounds kind of weird, but having them draw, having them play, those are great communication techniques with kids. Seeing how they play with dolls can be a big factor about, what do they learn? How is mommy and daddy in the doll world treating each other and acting? Is somebody hitting the baby of the dolls? So look at those kind of things, and not that there's 100% correlation with those, but with drawing and play and dolls and those kind of things, that's kind of how they express their world, and they might be able to tell you things that are occurring in their world. Also remember transitional items. So they might have a special teddy bear or a blanket. If possible, let them have that in the hospital. It smells like home. It's something that can generally calm them down. And so those transitional objects are a great thing to have and utilize. Just be very careful that we don't lose it. Like if they're going to surgery or something like that, I advise keeping those things in the room. We don't want them to get spilled on or lost or any of that kind of stuff. So you got to be very careful with the transitional items. Taking the history, so knowing the components. So of course with the adults you know how to do that. Kids, we've got some more specific things. So you got to think about how they're transitioning out. So especially talking about food, talking about diapers, talking about immunizations. Those are key areas for this. So nutritional assessment. So what are they eating 24 hours? 24-hour diet is great, but they're notoriously inaccurate. So if you can get them to write down, as they go along, we care about fluid intake, we care about nutrition, we care about calories, we care about all the micro and macronutrients. What kind of foods are they eating? Do they have balanced diets? We want to tailor to what they're used to. I think I gave you that experience of having a kid that just didn't like chicken nuggets and mac and cheese because it was a Western diet and they were used to plain rice and plain chicken. And so, tie that in, see what they normally eat and try to honor those requests. If they're vegan or vegetarian or have any other special needs, honor it as much as possible. So, other things we really want to do with these kids is just kind of look at their weight and looking at length. And so we're going to check their BMI as well. So often what we really care about is where they're at on that, where they plot out on the percentiles. And what we don't want to see is a huge jump up in percentiles or a huge decline in percentiles. So with this pediatric exam, try to make it as atraumatic as possible. I know that that's tough sometimes, but think about the long term. If you go in there, and you can go in there and you can be a bulldozer and just do what you have to do and get it done with. But every other interaction that you have with that child then is going to be scarred and it's going to have that taint. So make sure that you think the long game when you're working with kids. And I don't even think it's a bad idea when you're working with adults, because it'll set you up for a relationship that will help things out. So order of exams on adults, you were taught head to toe. For kids, we will go with whatever they give us. Oftentimes, if they are sleeping, you want to maybe start with listening to heart sounds and lung sounds when they're not screaming. When they start screaming, then you can maybe look in their mouth. You kind of take what they will give you. If you're doing more invasive stuff. So if you're looking in their throat with a tongue depressor, which most of the time we don't have to do, or in their ears, or at privates or anything like that, save that to last, because those are kind of invasive things, and that will maybe set you up for not being able to do good with your other assessments. So some good exams are here if you want to follow some examples. But always remember, we're looking, we're palpating, we're percussing, we're doing some auscultation. All right, some preventative care and some growth and development. So as we're doing prevention, think about that anticipatory guidance. Think about, height, weight, all those kind of things for wellness checks. Immunizations are a huge part of this. So all those things are imperative that we do on almost every visit with kids, whether that's a well child visit or even, when they come into the hospital. We'll probably check height, weight, and looking at that BMI, looking at the head circumference, those kind of things, if it's appropriate for that child. So, like I said, we're checking length for little kids. We're going to check height for older kids. And then looking here at scales and stuff like that, when they can sit up, when they lay down. In the hospital, make sure that you're using the same scale so that the weights are consistent. Usually they have one scale per wing, and so you don't want to be flipping and flopping them, because there could be variance between the scales. So vital signs, there's lots of different ways to do this, but I often will save the temperature to last, because it can be a little invasive. They don't always like being touched with that. If you're using the old stick thermometers, that is really invasive to them, because they kind of think that it's going into their body. So heart rate, respiratory rate, blood pressure, that all varies by age. Having a heart rate of 210 for an infant can be quite fine. If they're mad and the heart rate is variable, that's not an issue. But realize that all titrates comparatively as they age. So heart rate, respiratory rate will go down, blood pressure will go up with age, and so just kind of follow that age. So if you know what an adult range is, which you should by now, you should be able to add in what an infant's is, and then kind of make an estimation of where's preschool or school age and adolescence. Be aware though that sometimes with the adolescents, especially those that are very active in sports, their heart rate might be 45 to 50 if they're very healthy and very strong. So just be aware of those kind of trends too. Let's see here. Examination of systems to general appearance. What do they look like? Are they well dressed? Are they cared for? Have they bathed? Do they have anything going on with their scalp? Any lice? Any bed bugs? Anything like that? So just kind of a general appearance from the door. Do they have a smell to them? Those kind of things. So skin, looking for rashes, bruises, anything abnormal with that. And do make sure that you take a look at that skin. Just like the adults, it's important. Oftentimes we're looking for skin breakdown. Same thing for kids, but we're also looking for, rashes or other things like that. Skin, hair, nails, and hygiene. So, look at those kind of things. You know what you're looking for. Oftentimes in kids and adults, that's going to be about the same. You just have to realize that kids are dependent on their caregivers, especially the young ones. So this is a picture of a palmar crease. So simian crease is not PC anymore because it relates to monkeys, and you can see why that would be bad. But if you have, so this is normal, this is lacking that little midline here. This can be related to Fragile X syndrome or Down syndrome. If you look at this, don't freak out if you don't have that line. There's a subset of the population which is fine with it. It doesn't mean that you've got Down syndrome and been undiagnosed for these decades. But just realize this could be a sign and symptom of Down syndrome or Fragile X. Chest and thorax, so, listen. So you really want to listen bilaterally to your lungs. Ideally, you want to listen front and back, so anterior and posterior. Listen in between the ribs. Surprisingly enough, that helps you hear. Listen with both sides of your stethoscope. Surprisingly enough, that helps you hear. Cardiac murmurs are very common in kids, and if you listen, you will find one. Generally speaking, they're not super rare. So remember, your ape to man or all providers earn their money, and where are you listening with those kind of things. Abdomen, same assessment. Realize that liver might be a little low. In kids, we can have it 1 to 2 centimeters below the ribs. Hernias are very common, especially an umbilical hernia. We won't often treat that until about 1 year of age. If you're seeing other hernias like inguinal hernias or femoral hernias, those probably will get repaired. But just kind of watch for those kind of things. Otherwise, you're listening, and then you want to make sure that you listen before you palpate and do all that stuff, just like in the adult world. Lymph nodes, kids tend to get sicker more frequently, so you're going to be able to palpate more lymph nodes on kids than what you do in adults. Especially talking about those cervical chains. So right up here in the neck, you'll often palpate some lymph nodes. As long as it's, if it's more concerning if the lymph node is very, very hard, if it's greater than a centimeter, if it's only on one side, or if it's like stuck and it doesn't move during assessment. Those are red flags for that. But otherwise, it's very common for kids to have swollen lymph nodes. So HEENT, so oftentimes the nurse is not the one that's doing a lot of this stuff, but it's still good for you to have an understanding of, we do check eyes, we do Snelling tests, we do, look and see if there's any redness, swelling, exudate. We'll do cover, uncover. So, all those different things as we're looking in their eyes. We'll look for that red light reflex. We'll look for nystagmus, all those kind of fun things. So, with these, you're kind of looking at the nose and the eyes and how they're shaped. Realize that there could be some cultural deviations, variability, and that's fine. Often, school might be the first sign that a child needs glasses, so if they are not doing well in school, maybe they can't see. And they don't know that nobody sees that way. They think what they're seeing is probably normal, and that's what everybody else sees. And so we do need to assess that, and that can help them out in school. Ear infections in foreign bodies, in ears and other places are very common in kids. While I don't expect you to be able to do a full assessment of the ear like this is kind of what it looks like. It should be pearl-gray color. You should have cone of light that's coming off towards the jawline. You should be able to see all these little bones in here with the incus osseous and umbo, pars tensa. So all these things should be visible. What you're going to see with an ear infection is bulging, or maybe even there's discharge in the canal. It's red and it's swollen. But once again, that's usually not within the scope of a nurse. But realize foreign bodies are common. I have seen corn and beads and lots of different things within the ears, as well as the nose and other parts of the body. So realize kids are exploring their world, and they do some silly things sometimes. Look in the back of their throat. So we're looking for tonsils. We're looking for any obstructed airway type of thing. We're looking for exudate. We're looking for nasal drainage. We're going to look for teeth and seeing if there's any dental caries. So all these things are important. But make it a game. He's got a tongue depressor there. Oftentimes, if you can make it a game and make them, roar like a lion or open wide like an alligator, you don't need the tongue depressor. And the tongue depressor will likely make them gag and kind of wrecks your rapport with them if somebody's making you gag like that. Genital urinate, make sure you're looking at private parts. I know it's weird. I know that it often doesn't get done. But you need to look. Are the testes descended bilaterally? They're not going up back into the body cavity. You will see adhesions in little girls. And so, things are attached where they maybe shouldn't be. I know teenagers are not going to be crazy about this. And probably you should not be doing this one-on-one as a nurse, but somebody in the field should be doing it with somebody else in the room to verify that, yes, it was a mandatory thing and yes, it needs to be done. Neurological and musculoskeletal. So neurological, how are they acting? So this is just like the neurological exam in the adult world. Although make it fun, play games, really try and do things that are more interactive. Once again, it doesn't have to be in a straight line that we're taught with the adults, but it's take what they give you. One of the best things that I heard was like they call it a 3-second neuro exam, but it's things like, drop a piece of paper, see if they track it down with their eyes, see if they can go pick it up. Do they have balance? Do they have coordination? Are they able to use a pincer grasp? And what's their muscles like? What's their fine motor skills like? Can they make change? Can they stick out their tongue, which usually is not very hard to get a kid to do? Look at their eyes. What are their cranial nerves doing? So all those things can be done in kids, but like I said, try and make it fun. Some of the big developmental milestones, so look at things like your Babinski Test, and when does that flip over from, being childlike into adults? And so that's a good hint for you to look that up and see what that would be like for your test coming up. Also know that things change within their body. So little toddlers get that little bow-legged cowboy look, and that's normal. As they get older into the school age, they tend to go knock-kneed. And so realize that, valve gum, where their knees are stuck together with a piece of gum right there, is common in school age. And then verum is very common in toddlers. And so if you're seeing this in the opposites, that could be a sign that there's something wrong. So that is a quick rundown on how to communicate and what to look for, like an H&P and developmental assessment for kids. If you have questions with this, please contact me and I'm happy to help you out. I hope you have a great day. Bye.